So, hello. The case I want to show you today is the case of this 66-year-old man, very high cardiovascular risk factor, with polyvascular past history and coronary artery disease for 10 years, with multiple PCIs on the RCA and the LAD. And he presents symptoms of stable angina with significant inferior ischemia. You can see the angiography. The problem is on the right coronary with this suboccluded ostium with a competitive flow from the left side. And if we zoom, we can guess this big calcified nodule, paraostial subocclusive, and also instant restenosis and the neodistal very calcified lesion. All the arteries very calcified. So I will focus on the calcified nodule because it remains a big challenge in PCI today, with high rate of stent failure, mainly due to stent under expansion, even if we use some dedicated calcified preparation tool. And one of the way to get good expansion now is combined strategies like atherectomy and acoustic shockwave. But now, with the LithiX, what did we learn? With the Pinnacle study, there were 9 calcified nodules on the 63 lesion, and very good results only using the LithiX, with 100% angiographic success, no complication, and over than 100% stent and expansion. And this is due to the earth contact principle, because the calcium has a very high module of elasticity, and the hemisphere will split clearly the nodule, as you can see on the intravascular coronary imaging. And the fact that the calcium is very high module of elasticity will amplify the force of the hemisphere and really split the nodule. And I had also some personal cases with a calcified nodule. This one I showed it a few months ago on a webinar, and it was a left main distal with a very big calcified nodule identified of IVUS. And I could treat it with one LithiX 3.5. You can see on the IVUS the deep fractures and the very good results. So that is my strategy for this nodule. Challenging case, I needed very big supports. So I chose a 7 French AL 0.75 right radial supports. The first step was to cross with CTO toolbox. I used a microcatheter and I could cross it with a Gladius CTO guide wire. And then I could start my LithiX strategy. So the first step recommended is to predilate with a 2.0 balloon to achieve lumen, so you can really see the big stone of the calcified nodule and the ostium. And I did it also with a 2.5 non-compliant balloon. The second step recommended is to use intravascular imaging or stent boost. In this case, I had already many informations about the calcium, and I chose to use the stent boost and multiplying incidence. And then it was easy to cross with the 3.5 millimeter LithiX balloon. And I did prolonged inflations. I did low and higher pressure. I did many inflations with smoothly changing the position of the balloon so the hemisphere can go on different ways. And you can see here, it's still a big waist, but it's lifted a little bit. And then the fourth step recommended is to use systematically a non-compliant balloon then. So the fractures will go deeper. The LithiX initiates the fractures, and then the non-compliant balloon will go deeper. But there was still a waist. And what I found very interesting in this case, and I did it at first because I wanted to treat with the LithiX the other lesions more distal, that I alternated LithiX, non-compliant, then LithiX, then non-compliant 3 times. And then at the end, I could lift totally the print, the waist. And then you can see here, it was really easy to cross until the inferior genius with the LithiX, even if I inflated it 10 times on the calcified nodule. And I could treat also the other lesions with the LithiX. I had to use a guiding extension catheter to bring a drug elliptic balloon, while it wasn't necessary with the LithiX. So I treated it with a drug-coated balloon and in stent restenosis and distal lesion, and the stent at the end on the nodule. And here you can see the final result that I found very satisfying. So in conclusion, on calcified nodules, earth contact principle enables good stent expansions with the few LithiX case we could see already, without the need of combined strategies. And here, in this case, I found that alternating LithiX and non-compliant balloons several times restored vessel compliance and permitted to have no residual waste in this complex case. And once again, in this case, I found the LithiX really easy to use. With a good crossability, I could do many inflations. It had a very good safety profile and very good effectiveness, even on this case of nodule. Thank you.